Does your hip hurt when you first stand up? Or do you feel like you have to pause a minute before you can start walking? If so, this video is for you. Hi, I'm Dr. Dave Candy, and in this video, I'll share 5 tips to help you stand up from sitting without your hip hurting. Now, before we get started, it helps to understand what causes hip pain when you first stand up. And that largely has to do with muscles getting stiff when you're sitting. That can be various muscles, but most commonly it's your hip flexors. When you're sitting with your hips in a bent position like this, and one of your hip flexors, the iliopsoas, attaches to your hips and also to your spine. And so when you're sitting with your hips in a position like that, those muscles get shortened. Then when you go to stand up, they have to lengthen rather quickly. Additionally, if you're someone who sits with their legs crossed like this, it crosses the muscles on the outer side of your hip across the hip bone. That can be your gluteal muscles, such as your gluteus medius and gluteus minimus, or your tensor fascia lata and IT band. So if you sit with your hips crossed like that with those muscles on tension while you're sitting, then they may be a little bit more sore when you go to stand up. So the first tips to success to avoid hip pain when you first stand up actually start from your sitting position. You want to avoid sitting with your hips crossed like this for long periods of time, particularly if you tend to cross the same hip over. So ideally sitting with your hips more square, without knees together where it's socially appropriate, so that you keep everything in a nice straight alignment. Additionally, you want to avoid sitting on the edge of your seat with your back arched. When you're sitting like this, your hip flexor muscles, particularly your psoas, acts as a postural muscle to help support your spine, versus if you can sit further back in your chair and allow that psoas to relax, you allow the backrest to support your spine rather than your muscles having to work so hard to do so. Next, when you actually go to stand up, you want to scoot to the front edge of your chair and then lean forwards like this. This helps get your center of gravity over top of your feet so that your hip muscles don't have to work so hard to help you stand up. If you were to stand up just from a position like this, that takes quite a bit of leg strength, versus if you lean your trunk out forwards like this, you almost start to get up off the chair without doing anything other than shifting your weight. And so do that little hip hinge, getting yourself loaded over your feet, and then just push your hips up to standing. Now, it is a good idea to avoid going straight up into standing right away, particularly if you get pain in the back of your hips. When you've been sitting for a long time, your hip flexors get tight. Additionally, your lower back muscles get tight. And so if you stand straight up like that, sometimes going too much into extension right away can actually pinch some nerves in your lower back. So do the hip hinging, come up about 75 or 80%. And then tip number 3 is going to be to squeeze your glutes to get the rest of the way up. So squeeze your bottom muscles, kind of push your pelvic forward, and do a slight pelvic tilt like that. That way you're actually flattening out the curve of your lower back rather than excessively arching it. So again, tip 2, hip hinge, come up about 75-80%, and then tip 3, squeeze your glutes to push your hips underneath of you. Now, as you're squeezing your glutes, you may also want to think about turning your knees out slightly. That activates your gluteus medius and gluteus minimus on the sides, which give you more stability when you go to shift onto one leg to take a step. So the next step is going to be actually taking the step. That if you have one hip that hurts more than the other one, often it helps to step with the other leg first. So you squeeze your glutes, shift the weight out over onto this leg, and then step with the other one first. That way you kind of stretch the hip flexor muscles as you go to take a step before you go to step onto the more painful leg. And then the final tip is to take smaller steps. If your hip flexors are tight and you go to take very large steps, it's going to cause your lower back to arch, which can sometimes refer pain down into your buttock or your hip. So after you've stood up, squeezed your glutes, step with the good leg first, then just take slightly smaller steps for your first couple steps. And as you continue to walk, your hip muscles will loosen up and allow you to walk more comfortably. So hopefully you did find those tips helpful to stand up with less hip pain. Now, if you get hip pain when you're actually sitting, check out this video up here. Or if you get hip pain when walking, check out this other one down here. But before you go watch those, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.